do better for our patients and for even for nursing staff, so not just solely patient focused, of course focusing on nursing as well. And then as I started reading more, I'm like, oh, this develop and implement and evaluate a public health initiative, which I'm not really sure how in detailed that really is, exactly how much and how ongoing it needs to be. That sounds like that would be fun because I do help teach CPR in the community, and that's probably one of my most favorite things to actually do, because people in the community are so grateful because they truly want to learn, you know, and really have that experience. I'm definitely not going to write an article for publication. I can tell you that.
Me either.
Not just because that just doesn't sound fun.
Writing yourself, yeah.
So probably something, if I do something quality improvement like patient focus, it's probably going to have to do with like bedside shift reporting is kind of what I'm leaning towards initially. But then that community public health initiative thing sounds kind of appealing too. It sounds like that would be something really fun to do out in the community, because we are a small town, so most of our patients live very locally to where we're located.
Nice.
It would be nice to kind of branch out a little bit.
Yeah. So when I hit the broadcast button, it didn't actually work.
So we were practicing?
We were just practicing. So I hit it when Nicole started. So Pam, you and I have to re-go again. I'm sorry. I don't know. The green button turned white, so I thought it was working, but it's not. But it's working now.
So mine is showing live. So
mine is showing live too.
Yeah, mine's showing live now, but before it wasn't.
Okay.
So I'm not sure if it got recorded or not. So I'm sorry.
I'm trying to get the handbook, y'all. I'm still fighting with it.
Okay. Well, while you do that, I'll just go again, just in case.
Okay.
Okay. I'm Serena Gurfey. It's been 17 years in the Navy. I have 2 years as a nurse at the Naval Hospital in Portsmouth, Virginia. I'm doing leadership. So I narrowed it down to 3: solve a safety problem, implement new technology, or participate in an ongoing research study, which is the one I'm probably leaning towards, because we have a research team at the hospital, and it would just be easy enough to get on that team and to, you know, do whatever is required for that. The safety problems, we have a lot of them at the hospital. It's hard to pick one, but I was thinking if I did that one, I would do falls, because we have a lot of falls at the hospital, just because patients just don't realize that they're fall risk, even though you tell them.
Yeah.
Yeah.
You relate to that.
Yeah, I know, right? Or implement new technology. I like the ones where you can scan the meds at the bedside, but we can't do that at our hospital because of security reasons. I'm not sure what those security reasons are, but it might be interesting to do a little bit of research on that to see why we can't do that, and if we can, to implement that, because that would be kind of nice. It, like I said, drastically reduce med errors. So that's all I got.
Oh, okay. Well, I guess I'll go again just in case. I think my project will fall under probably sort of like, I forgot your name. What's your name? The quality management or the patient safety. I was talking about trying to find a safe facilities for kids that are addicted to drugs and alcohol, because a lot of them are getting pushed through the adult system. And having to room with, adults or whatever, or they turn a certain age, like 17, and until they're 18, they're, if they're 17, they can stay with the kids, but once they're like 18 or whatever, they go over to the adult side or whatever. Anyway, there's not enough facilities, from what I've seen, for the kids to get help for, their addiction. So I think we need to kind of find more facilities for the young kids that are addicted to the drugs and have mental illness, so that they don't fall through the crack, and they can get help early and it won't progress, when they're adults. carry over into their adulthood.
Mhm. You know, when I was in Charleston going to school, one of the mental health facilities that we went to for our clinical, they had a little section for teenagers and stuff. I thought that was pretty interesting.
Yeah, where I work at now, which is Cherry Hospital, they have a section and for the kids. They have their own building, they do school or whatever. But there were other facilities in North Carolina that had closed down, so the kids are being forced to come over to the adult facilities, and you have to make room for them.
Mhm. Yeah, I like that. You find my lady? Yep.
I am Beverly Brock. I am currently an adjunct instructor for Careers Pathway Program at Central Carolina Community College in Sanford, but I work at the historic W.B. Wicker site. It's an old school that's in the African American community that the college has kind of renovated and trying to keep it going. I am currently doing education. I want to continue teaching, and that was my long-term goal. And I looked at the possible projects, and since I am teaching, so I'm kind of gearing toward it. It says teach a college level RN class or teach a college level clinical group for 45 hours of clinical. So I've kind of narrowed it. I'd probably do one of those two projects. I got to look into it a little bit further, and I'm kind of trying to get myself geared toward who I would want to have as a preceptor. And at my college, we've got some excellent teachers. So that's kind of like where I'm leaning toward. And I saw the one where it says meet a knowledge gap on a nursing unit. I'm not really affiliated with a unit per se. So I'd probably lean toward those first two, one of those.
Sounds interesting.
Yeah.
Did I say enough, y'all?
I think so. I think we've met the 15-minute requirement.
So is there a way we could review this to see if anything, or if we recorded or double recorded, or?
I have no idea. I think it goes to my YouTube channel.
Okay.
And then we just cut and paste it into the thing. I'm going to stop the broadcast now.
Okay.